Hello everyone and welcome back to ICT Kikkawa College Massage Therapy School, where we demonstrate a variety of massage techniques and assessment techniques. Today I want to talk about knee assessment and how do we select tests to assess this area. Well, the number of tests usually depends on the number of structures that may be responsible for the chief complaint. Thus, when somebody comes in with knee pain, I know that I have to do something for the lateral collateral ligament, medial collateral ligament, anterior and posterior cruciate, medial meniscus, lateral meniscus, patella, and maybe the distal end of the iliotibial band. Meaning that if I do ranges of motions, then I need to select at least 6 or 7 special tests to test each one of these structures that may be responsible for the initial chief complaint. Okay, so I'm going to demonstrate a variety of special tests for each one of these anatomical structures. Okay, Andrew, so now that you gave me your consent, I'm going to proceed with the assessment. With the first test, I'm just going to take your leg and move it from side to side. You don't have to do anything at all. Any pain or discomfort?
No.
Any pain or discomfort?
Yes.
Can you show me where the pain is? Is it local or does it radiate?
Local.
Okay, are you okay to continue?
Yes.
Can you lie down on your back, please, with your feet on this end? I'm just gonna put your foot on the table and move your leg back and forth. Any pain or discomfort?
No.
Any pain or discomfort?
No.
What about now? Is that painful? Are you okay? Can you turn over and lie down on your stomach, please? Are you okay? Is it painful?
No.
What about now?
No.
Are you still okay?
Yes.
Is it painful?
Yes.
Okay. Is the pain in the same area?
Yes.
Is it the same type of pain that you felt before?
Yes.
Very well. Can you have a seat, please? Okay, so here I did a variety of tests for medial and the lateral collateral ligaments, cruciate ligaments, menisci, and the patella. They are called valgus, varus, anterior drawer, posterior drawer, patellar grind, Apley's compression, Apley's distraction. But the name of the test doesn't really matter. The point is that we take every possibility or every structure that may be causing the pain in the knee and we apply stress, either compression or stretch to the area. And then based on the client's answer at the location of the pain, the clinical impression would be developed.